So let's suppose we are in the delivery room and our patient is about to deliver the baby. Everything is going smoothly, like patient is having fully cervix dilation, patient is having good contraction as well. But the problem is the baby head is already delivered, but the baby's shoulder is stuck inside the mother's pelvis. This condition is known as the shoulder dystocia. So hello everyone, myself Mohit Kumar, and I'm going to demonstrate you how to deal with the patient with the shoulder dystocia. So we have to just do some maneuvers to just release the shoulder of the patient. We're gonna just follow the series of maneuvers, which is with the mnemonic of alarmers. So we're gonna follow that series. But before doing anything, we have to make sure we have diagnosed the shoulder dystocia properly. At the time of the delivery, we will see the turtle sign, and once we made the diagnosis of shoulder dystocia, we have to announce it loud and clear, like that. Like, my patient is having shoulder dystocia, we're gonna perform certain maneuvers, so I need help, at least two people to assist me. We should have at least one person on each leg. Let's begin with the first maneuver. We're gonna do the Mac Roberts maneuver. So in this maneuver, we're gonna just hyperflex the leg of our patient. So will you please assist it? Okay, hyperflex the leg up to the abdomen of the patient, and it will help us to state the sacrum of the patient and will add some space to the passage of the baby, okay, and help us to deliver the baby. If not successful up to now, then we have to see baby is in the right occiput position. Now what we're gonna do, we just apply the suprapubic pressure. This is the second maneuver. So you're gonna apply the suprapubic pressure like this, okay, and we have to gently pull the baby downward or upward. If we are not able to deliver, then we have to go for the next maneuver. But in most of the cases, around 99% of the cases, we would get the positive outcome by these two maneuvers. But if it's still not, then we will go for the other maneuver. So now we will try with the posterior shoulder delivery. So what we have to do, we have to insert our hand like this in the posterior side, and then just figure it out, like where is the shoulder of the baby. And if we are able to grab the shoulder of the baby and we are able to deliver the posterior shoulder, so we have to make sure that everything is going gently, because we don't want to do any injury to the baby or the mother. So after delivering the posterior shoulder of the baby, then we have to just apply the downward traction and the baby will be delivered. So in the most of the cases, up to here, we will successfully able to deliver the baby. But if not, then we will go for the further other maneuver, which are the rotational maneuver. We can go for the Robbins maneuver or the Woods Krog screw maneuver. So what we're gonna do, we are just doing here the Woods Krog screw maneuver. So we just gently insert our finger, or if possible you have a small hand, you can gently insert your hand like in the posterior and the anterior, on the anterior shoulder of the baby, and just gently rotate it at 180 degree. We have to make sure we are just providing the proper support to the shoulder of patient. And at the time of rotating, we have to also make sure if we are able to deliver any shoulder of the baby, then we have to just go here, we have to try to deliver any shoulder, and hopefully it will work. And if still we are not having our favorable outcomes, then we will go for the another maneuver, which is known as the episiotomy. So after doing the episiotomy, that will add some space to the passage of the baby, so that will help us to deliver the baby. If it's still not able to deliver, then we will go for the last maneuver, which is like all four maneuver. Means the mother is going to be on her all four, like both hand and both legs or the knees. And it would be a bit tricky because the patient is already on the spinal or the epidural anesthesia. But if we are able to manage it somehow, this is the position of mother like this. So we have to take the advantage of the gravitational force, just gently apply the downward traction and deliver the baby's shoulder. Let's suppose if still we are struggling, we are not able to deliver it, then what we're gonna do, we're gonna do some last maneuvers, which is known as the Javanelli maneuver. We're gonna insert the baby head back inside the mother's pelvis, okay? Then we can just go for the simple cesarean section. This is the most, safest method to do at this time now. But if we are not able to just push it back in the mother, then we have to go for the lower abdominal C-section as well. If due to some other comorbidities we are not able to do this C-section as well, then we can go for the which are the special maneuvers, I'll call it, because if you are expert of doing the clavicle fracture and just deliver the baby, if you are expert, then you just attempt this maneuver, like the breaking the clavicle of the baby, because otherwise it could do the more damage to the baby. It could puncture the lungs of the baby. So if you are expert of doing that, we will just attempt for this maneuver. Otherwise, we can go for the last maneuver, which is symphysiotomy. Means we're gonna just check the pubic symphysis. We're gonna remove the extra ligaments from the pubic symphysis and just try to relax it. If it's still not working, we will just cut down through the pubic symphysis and then open it, and then we will deliver the baby from this method. Okay, these were the maneuvers how we have to deal with the shoulder dystocia. That's it. Thank you so much for watching. Bye bye.